Good morning, ladies and gentlemen. Welcome to the last lecture of the last week of this course on physical medicine and rehabilitation in sports. This is lecture 5 of week 8, and in this lecture, we will be discussing some strategies for psychological rehabilitation post injury. We have seen some details in the previous lecture. We will be delving a bit more in this lecture, and we will try and develop some strategies for post injury rehabilitation. I will be covering this lecture as per the following outline: introduction, objectives, psychological response to injury, role of social support systems, coping strategies, tools, recent advances, and conclusion. We have discussed that psychological rehabilitation is very, very important in sports injuries and is now, in fact, a prerequisite for modern sport. It is very important to address the mental health during the recovery process in sports injury. And we should be aware of some of the strategies which are used in psychological rehabilitation so that we can, whether we are a sports medicine doctor, a strength and conditioning coach, or athletic trainer, physiotherapist, etc., we should be able to support the sports psychologist in his or her endeavors. And there is a good role of interdisciplinary support in psychological recovery because if the psychologist keeps propping up the athlete in a positive manner and his or her coach keeps bringing down the athlete emotionally, the psychological rehabilitation is not going to work. The objectives are to understand the psychological effects of injuries, to identify the psychological rehabilitation techniques, to explore some strategies to enhance mental resilience, to discuss the role of support systems in recovery, and to learn about mental training tools for post injury confidence. The psychological response to injury involves common emotional reactions such as shock, denial, anger, depression, and acceptance. If the injury is severe and if the rehabilitation is long term, then the psychological responses are more severe. There are several factors which may affect an athlete's mental response, including age, skill level of the athlete, peer support, family support, financial status, job, etc. etc. Consequently, there may be psychological barriers to full recovery, and we should be in a position to pick up these psychological barriers and address them. It is very well known that there is a prevalence of mental health disorders such as depression and anxiety post injury in injured athletes. We discussed some of the symptoms and early identification drills of depression and anxiety in the previous lecture. Basically, anybody seeming off psychologically, aloof, withdrawal, aggressive, lack of sleep, all these symptoms should be watched out for. And we must use the sports psychologists very early for the treatment of depression and anxiety. And if the depression and anxiety is very severe, we must use psychiatric support and drug therapy because the effects of untreated mental health on rehabilitation is very, very severe. Fear of re injury and performance anxiety is one of the psychological barriers to resuming training and competition. We have to start techniques to rebuild confidence for return to play. Get the athlete back to sport in a gradual manner so that you can overcome the fear of the athlete. And for management of the fear, we may be needing to use cognitive restructuring techniques for fear management. There is an identity crisis and loss of self esteem seen in athletes who undergo injury because they feel they are worthless and they have lost their athletic identity. We have to teach them strategies to rebuild their confidence. We have to give them career counseling in long term injuries. And we have to talk to them about case studies of athletes who have dealt with identity loss and severe uh, sports injuries. Importance of social support systems. Teammates, coaches, families, peer. They are very, very important. And the psychological benefits of these peer support groups cannot be negated. We have to ensure that the athletes stay connected to all of these people: family, coaches, peers, teammates, supporters, fans, etc., during their rehabilitation process. And there is a strong impact of positive team culture on psychological healing. If the team culture is positive and strong, then psychological healing is better. Sports psychologists are very, very important. They use psychological counseling techniques, they use cognitive behavioral therapy, they use case studies, and there is very little doubt that early psychological intervention is effective in sports rehabilitation. The earlier, the better. Mental skills for rehabilitation. We have to teach the athlete these mental skills: visualization techniques during the recovery, positive self talk and motivation, relaxation and mindfulness exercises, and how to develop mental toughness through adversity. These are very important techniques, and the role of the sports psychologist is very, very important before the recovery, during the recovery, and after the recovery. Coping strategies. We have to teach the athlete how to develop resilience through structured rehabilitation. We have to teach the athlete the importance of goal setting and how to track the progress throughout the recovery. Encourage a mindset of growth during the rehabilitation phase for the athlete, for the teammates, for the coaches, everybody involved. And please teach the athlete psychological flexibility during the recovery process. There will be setbacks, and the athlete should have the psychological flexibility to deal with that. Psychological preparation for return to play. We must teach the athlete, or we must take the athlete through the steps to build confidence post injury. We must give them exposure therapy for overcoming fear. We must manage the expectations for performance recovery, and we must manage the team around the athlete also, and make sure that they do not have high expectations or low expectations. The expectation should be appropriate. And gradual progression in return to play protocols should be ensured and monitored. Rehabilitation, adherence, and motivation. There are several well researched factors which are known which influence the compliance with rehab programs, and they should be watched out for. We should have strategies in place to maintain this motivation over time. The supporting network should always be giving positive reinforcement to the athlete. And there should be a connection between motivation and physical recovery. Mindfulness and recovery meditation. Mindfulness is very, very important in injury rehabilitation and has shown to give good benefits. Meditation may not be possible for an athlete, so guided meditation techniques should be taught to the athlete for pain and stress management. Case study discussion should be done with the athlete to demonstrate the efficacy of these modalities. And we must talk about how mindfulness and meditation reduces performance pressure upon return with the athlete, coaches, and teammates. Placebo effect in psychological recovery. There is a strong placebo effect in treatment outcomes, and the person with a stronger mental belief will have better treatment outcomes. Psychological versus physiological healing is important, and both have an equal place in the recovery process. Positive expectations can push an athlete forward or pull an athlete down. So the athlete should learn how to manage these positive expectations in a positive manner. Placebo based recovery should be used, and the role of confidence in placebo based recovery benefits should be explored and used by the sports psychologist. The role of coaches in psychological rehabilitation. Coaches are very, very important. There's no doubt about it. They should have an effective communication strategy for injured athletes. Coaching methods should incorporate techniques to rebuild athlete confidence. The coaches should encourage psychological resilience through training. And coaches should be able to recognize and address psychological struggles by the athlete. In fact, all support staff should be taught this. Family and peer influence, very, very important. There is a strong correlation between emotional, mental support given by the family and peer group and recovery in time. The recovery mindset improves if peer encouragement is given. And we should use strategies to keep the athlete engaged with their team members. We must educate the family about mental health support for injured athletes. There are several psychological assessment and screening tools available to the sports psychologist. There are standardized questionnaires, mental health progress recovery questionnaires. There are case studies which are available for effectiveness of psychological assessments, and individualized recovery programs can be mapped and tweaked using these assessment tools. Psychological recovery is a multidisciplinary approach which should involve collaboration between psychologists, physiotherapists, and coaches. In fact, the entire medical and support team of the team should be involved. Holistic rehabilitation programs integrating mental and physical recovery should be practiced by the team. And there are several best practices which are available for multidisciplinary care. And please do not forget the role of nutrition and lifestyle in psychological healing. Role of virtual reality and technology in rehabilitation, very, very important for the future. VR is being used for mental conditioning post injury, and artificial intelligence driven psychological assessment tools are being used for rehabilitation. Future technological advancement in rehabilitation should be aware, we should be using them also. And wearable technology for mental and physical recovery tracking should be utilized in a judicious and scientific manner. There are several success stories of athletes overcoming psychological barriers. We should get into the details of the rehabilitation plans which have been used by these elite athletes. We should learn the lessons which have been learned from these psychological recovery programs, and we should use this knowledge for replicating elite level psychological interventional strategies at our level. Sports culture is very important in psychological recovery. Different sports handle psychological recovery in a different manner. There are cultural variations in injury perception and recovery, which may be culture, race, religion, or country specific, which we should be aware of. We should use all this knowledge for creating a supportive sports environment. And please be aware of the impact media portrayal on the mental health of the athlete. Future trends in psychological rehabilitation. We should be aware of emerging psychological therapies and interventions. There is a strong evolving role of sports psychology in sports rehabilitation. Mental training integration should be done into the injury prevention program, and individualized mental health coaching should be offered to athletes, coaches, and all support personnel. Psychological rehabilitation at the grassroots level. We always talk about the elite and the sub elite level. However, it is very important that mental training be taught to the youth athletes. We should teach these young athletes coping skills for injuries. And we should get into the role of schools and academies in the psychological resilience training. We must be available to prevent long term mental health issues from early injuries and try and bring these athletes back to sport without any long term psychological effects upon the health. Psychological recovery programs in teams. How teams can incorporate these mental health strategies is an important aspect which the team psychologist can get into while managing the injuries of the athlete and the team. There must be practical strategies for integrating psychological support into training. We cannot keep talking about theory and scientific protocols to athletes, coaches, and their teams. We must give them practical strategies for integrating these psychological support programs during their training programs. And we must encourage open discussions on mental health in teams. Psychological rehabilitation strategies are important and they are key to a successful overall recovery. Mental well being is important in overall recovery and, more importantly, in recovering from a severe injury. We must encourage proactive psychological support in sports and we must foster resilience in injured athletes. The future is integrating psychology into sports medicine for shortening the rehabilitation process. These are the references I've used for preparing this lecture, ladies and gentlemen. I strongly urge you to go through them. We do have a week ending assignment and a course ending exam, which is offline. Thank you, ladies and gentlemen, for attending this course, for your support and patient listening throughout this course. Thank you and Jai Hind.